Podcasting from eHealth New South Wales. This is Let's Talk eHealth.
Welcome to Let's Talk eHealth, a podcast designed to showcase the projects and people we have at eHealth New South Wales. Today we're talking about the role of a CXIO at New South Wales Health, who they are and what they do. I'm Hannah Dawkins from the eHealth New South Wales Communications team, and I'm joined by Dr Sarah Dalton, Clinical Lead on the Single Digital Patient Record at eHealth New South Wales, and Peter Edwards, Chief Clinical Information Officer at Western New South Wales Local Health District and Far West Local Health District, and also a CXIO. Welcome, Sarah and Peter.
Hi, Hannah.
Hey, Hannah, how are you going?
Yeah, good, thanks. Thanks for joining us today. So let's talk CXIOs. CXIO stands for Chief Clinical Information Officer, and the clinical part can be anyone from an LHD with a clinical background. So Sarah, let's start with you. Can you tell us a little bit about the role of a CXIO and how they fit within the hospital system?
Thanks, Hannah. I'm aware that some people may never have heard of a CXIO, and basically this is a clinician with digital health expertise. CXIOs help share information and knowledge between clinicians and IT professionals. They champion the efforts to integrate IT systems in their local health districts and improve the provision of care to patients. I think it's important to say that these roles are really strategic, senior clinical digital leadership roles. And in that senior role, CXIOs collaborate closely with key stakeholders in selecting, implementing, managing applications across the LHD or whatever's provided under the shared services arrangement. They're also playing a really important role in advocating for and building digital capabilities across the clinical workforce. I think it's fair to say the CXIO responsibilities span across various domains, everything from strategy and operations to advocacy for clinically led improvement, at the same time as collaborating across the LHD, New South Wales Health and beyond. There's plenty of examples of the work that they do around EMR, virtual care, and ultimately I think CXIOs are really important advocates for improving technology at the point of care.
Then how exactly does eHealth New South Wales benefit from engagement and conversations with CXIOs?
CXIOs really do help eHealth New South Wales by bringing a clinical viewpoint to the table. And because they understand both IT and their clinical experience, they have invaluable insights to share. CXIOs get involved in decision-making across many different parts of eHealth in procurement, design, implementation, and evaluating the digital health activities in New South Wales Health. I guess because CXIOs are experts in clinical digital health, they're really well placed to lead and support clinicians to deliver evidence-based clinical practice, where we're really looking to improve the effectiveness and efficiency and safe use of ICT. Clinical applications need to be designed in line with latest evidence and can enhance care delivery through optimum design and use of digital tools. Clinical digital health systems can improve healthcare if they're designed effectively, are safe to use and add efficiency to care delivery. And clinical information systems are tools or platforms designed for use by clinicians to deliver care. At the end of the day, CXIOs as customers who use the clinical information system or electronic health record, we really need to hear the input from these people.
And Pete, over to you. What is your experience of being a CXIO? How did you get here?
My role as a CXIO has come about organically. I am a clinician by trade, and I say by trade because I started as a trainee enrolled nurse and did some education through the TAFE system as well as learning on the job. I then went on to become a registered nurse and have worked in differing roles in the intensive care, clinical nurse educator, NUM, nurse manager, etc. And as part of that, the technology seemed to gain ground as part of my journey through health. I started where there was only a single computer inside the wards, and now we're surrounded by them and surrounded by systems and technologies that help improve the care of the patient. And that's always kept me interested. It's something that gets me up in the morning, and it also keeps me awake at night trying to strategize and plan and think.
And how do you, engage with other CXIOs to generate important discussions or drive change?
Look, it's important to have that community because we can bounce ideas off each other to improve the care for our patients. We also can look at an initiatives that we've got in each respective LHDs and see which can be adopted in other LHDs, and then also drive state initiatives and push for alignment that are centred around the patient.
And what conversations have you been a part of since becoming a CXIO? What changes or impacts have you seen?
There's different initiatives that we've been involved with eHealth New South Wales that have been of benefit to the patient, whether it was the connection of the HWAN solution, which gives us better connectivity, network initiatives, what gives us connectivity through the computers inside the hospital, and then smaller initiatives such as being able to upload images into our record.
And I'm interested to hear from both of you on this. Could you talk about how CXIOs and eHealth New South Wales work together, supporting each other to promote digital health?
I'm happy to jump in there, Hannah, and I really just keep talking, as we just heard from Pete, about all the amazing opportunities there are and the great insights that we have from CXIOs. There are lots of opportunities, and over many years there's been design working groups where CXIOs and clinicians have been involved to design new and then also continually enhance the current solutions that we have. A good recent example is the COVID Clinical Advisory Group for EMR, which over the last couple of years has delivered rapid statewide solutions such as discharge summaries for COVID-positive inpatients and antiviral prescribing. And actually, I think there's over 40 other committees and groups where CXIOs are providing expert digital health input. You've already heard about SDPR from Pete. There's an enormous amount of work and opportunity in that as well. So we're really very lucky to have the opportunity to work carefully and closely with the CXIOs.
And it's important involvement of having a CXIO on all those different committees, whether it's at steering group committees versus having them at design committees, because it ensures that the patient is at the centre of the design and of any program that's being run, but also that the clinician's input allows for it to be usable systems or solutions for the outcomes of what's being delivered.
Wrap this up for us. What would you both say to clinicians who wish to build their skills as clinical digital leaders?
Jump on board. If you see an advertisement for a position that's related to digital health, have a go, apply. It's not going to be something that you're going to look back on and regret. There is lots of different pathways that you can get into this, whether it's being part of a project team or being part of a support team, or even just being an educator on the ward. There is lots of opportunities to be part of what is going to be surrounded by us forever and a day, which is technology and how it's going to help the patient at the centre of our care.
Look, I couldn't agree more with Pete. I think this is a matter of choose your own adventure. Ultimately, we're all here to do the right thing to make our systems better and really provide better care to patients. And we have an incredible opportunity to get on board. So at the end of the day, just say yes.
This has been such an interesting discussion. Thank you, both of you, for joining me today to discuss the role of a CXIO within New South Wales Health.
Thanks, Hannah. Really appreciate it.
Thanks for listening to Let's Talk eHealth New South Wales. If you enjoyed the show and want to learn more, visit www.ehealth.nsw.gov.au.